right, I think we're ready to get started. Happy Friday. Glad you all could make it to join us today. Welcome to the Indiana Professional Management Group's webinar, Medicaid Eligibility, Understanding the Essential Concepts. I'm Megan Warren, the Professional Development Specialist here at IPMG. Please advance the slide. Thank you so much. Before I introduce today's presenter, I'd like to go over a few housekeeping items. Webinar attendees will receive an email verifying attendance after the webinar. IPMG employee owners should use this email as the certificate for your training credit. Within 2 business days, the recording of this webinar and follow-up information will be posted in the webinar section of IPMG's website, and that is www.go2ipmg.com. A question and answer document will be available with the recording. The recording of this session will also be posted in IPMG's YouTube channel within 2 business days. If you have any questions during the session, please add it to the questions box. Please be sure to add only general questions to the questions box. If you have specific questions about your case, you should reach out to your contact at IPMG. We'll compile all the questions and answers into a question and answer document that will be posted in the webinar section of IPMG's website. All right, now I'm happy to tell you about today's presenter. For over 9 years, Beth Peabody has worked in case management with IPMG as a case manager, an engagement specialist, and eligibility coordinator. She has a bachelor's degree in psychology and an associate's degree in medical assisting. Beth has experience working in a hospital setting as a field representative for a medical advocates group where she assisted uninsured patients with obtaining Medicaid coverage and benefits. Beth currently works as the eligibility coordinator for IPMG, supporting case managers and rep facilitators and assisting individuals served by IPMG to maintain Medicaid eligibility. Beth is a graduate of the previous IPMG Emerging Leaders program, where she also served as a mentor. Beth, we're really looking forward to hearing from you today. I'll let you take it from here. Thank you so much.
Thanks, Megan, and apologize again to everybody for our technical difficulties, but thanks for hanging in with us. So thank you for joining me today for IPMG's informational webinar, Medicaid Eligibility, Understanding the Essential Concepts. The goal of this training is to provide information about the basic components of Medicaid eligibility, and it is tailored for individuals receiving services through one of the home and community-based waivers. It is meant to provide general information about the most common concepts that we face related to Medicaid eligibility for individuals on the waiver. This training is not able to get, unfortunately, into extenuating circumstances or very specific policies. I will address how to apply for Medicaid, how to maintain Medicaid eligibility through the annual renewal process, and how to reestablish Medicaid following a loss. There are also some resources that I will share at the end of this presentation. The information presented today is based on typical eligibility criteria, and everyone is encouraged to cooperate with any requests made regarding Medicaid. I'm going to start with reviewing some of the terms that we will be using during this presentation. These include Medicaid, the Medicaid waiver, the Division of Family Resources, also known as DFR, your Medicaid aid category, traditional Medicaid, and an authorized representative for Medicaid. It is essential for the rest of the training that you have a good understanding of what these concepts are so you understand what I'm trying to explain. So Medicaid is a public health insurance program. It is a comprehensive health insurance that covers hospitalization, doctor's appointment, therapies, pharmacy, as well as some things that may not typically be covered by your private insurance, such as transportation to medical appointments and incontinence supplies. It is open to people of all ages whose income and resources meet specific guidelines, and Medicaid is jointly funded by the state and the federal government. The federal government is the one that outlines the components that need to be included, but the state has the ability to set guidelines within that framework. So the eligibility standards as well as the actual coverage can vary from state to state. A waiver participant must have active Medicaid to use their waiver services. I often hear that Medicaid could not have lapsed because the person has a waiver. I believe that may be tied to some kind of myth or misunderstanding out there. Eligibility for Medicaid is established separately from eligibility for the waiver. Unfortunately, approval for the waiver does not provide continued eligibility for Medicaid. Eligibility for Medicaid needs to be redetermined annually unless the individual is receiving SSI or Social Security income benefit. There really needs to be a designated person taking responsibility to help maintain an individual's Medicaid eligibility. The responsible person is typically the individuals themselves, if they are over 18, emancipated, the parent of a minor, a guardian, or an authorized rep, maybe a friend of the individual who has agreed to assume the responsibility. The Medicaid waiver program provides needed wellness and or disability-related services in the home and community. It essentially waives the requirement for those services to be provided in a facility, such as a nursing facility or group home. The home and community-based waivers are administered by the Division of Disability and Rehabilitation Services through the Bureau of Disability Services, BDS. They are the family support, community integration and habilitation, health and wellness, and traumatic brain injury or TBI waivers. A person must have active Medicaid in order to use waiver services. Medicaid and the Medicaid waiver have separate eligibility criteria. So eligibility for one, unfortunately, does not assume eligibility for the other. The Division of Family Resources, as I said, also known as DFR, is a state agency under the Family and Social Services Administration, or FSSA. It is responsible for establishing eligibility for Medicaid, as well as other programs such as Supplemental Nutrition Assistance Program, commonly referred to as SNAP or food stamps. The DFR is responsible for processing Medicaid applications, as well as determining ongoing eligibility for Medicaid. So Medicaid is really a broad definition, and there are many programs or types of Medicaid. A Medicaid A category is a designation of how a person is eligible for Medicaid and the type of coverage they have. It is essentially the path to Medicaid. Each aid category has its own set of guidelines for eligibility. Some aid categories are based on household income and the age of the applicant. Others include factors such as being a foster child or having a disability. The aid category will be initiated and determined by the Division of Family Resources. The aid category is determined based on the current financial and disability-related information provided. You typically do not need to request a specific aid category if the Division of Family Resources is aware of the waiver. However, if there's a change in circumstance, you will want to report that to the DFR, as an aid category change may be required. Examples would include like a change in type of Social Security benefit, adoption subsidy ending, or stopping work. It is important to know the aid category that you're on, as it helps you understand the eligibility requirements for continued benefit. The aid category is typically on notices from the DFR. However, it's not really obvious where it's printed. You can always contact the DFR to determine your aid category, or your waiver case manager has access to the aid category if the Medicaid is active. Although it is important to know the aid category, the Division of Family Resources determines this aid category. Not all Medicaid categories, unfortunately, are compatible with the waiver. If you're receiving waiver services, it's pretty safe to assume that your Medicaid is the right aid category, as long as there's been no lapse in coverage. The most common aid categories for a waiver participant are the aged, blind, disabled, and employees with disabilities, also known as MedWorks, and SSI recipients. There are other aid categories, primarily for minors and young adults, that are compatible with the waiver. However, the waiver does not have any impact on eligibility for Medicaid. We're going to focus on Medicaid for the aged, blind, disabled, MedWorks, or Medicaid for the working disabled, and SSI recipients aid categories through this presentation. The majority of Medicaid recipients are enrolled with a managed care entity such as CareSource, MHS, United Healthcare, or Anthem. That means the managed care entity is monitoring your use of Medicaid, encouraging you to seek preventative care to help keep costs down, and requiring you to see doctors within their network. Individuals on the waiver do not participate in managed care. Their Medicaid allows them to see any doctor who is enrolled with Indiana Medicaid. They typically don't need referrals to see specialists. When a Medicaid recipient is not enrolled with a managed care entity, they're considered to have traditional Medicaid. So if a doctor, therapist, or pharmacy ever asks what kind of Medicaid you have, you want to reply that it is traditional Medicaid if you are on a waiver. If you're enrolled in managed care prior to the waiver, you will automatically be disenrolled from managed care when you start the waiver. An authorized representative is a designation made by the DFR that allows another person or agency to advocate or represent the Medicaid recipient when communicating with the DFR. It can be a family member, a provider, or a friend, really anybody that the Medicaid recipient wants to designate. It can be an individual person or agency as well. Due to privacy laws, the DFR caseworker can only communicate with the Medicaid recipient, the parent of a minor, or the legal guardian. The authorized rep form can be completed and submitted to the DFR. I do highly suggest that you take this form into the Medicaid office in person if you're able to, and make sure that it is worked into the case. Again, it allows the caseworker to talk with the designated rep regarding the status and the specifics of the individual's Medicaid case. It also allows the DFR to send copies of notices that are sent to the Medicaid recipient. A person can have more than one authorized rep, and if the person has a legal guardian, copies of the guardianship papers need to be submitted to the DFR before the caseworker can talk with the legal guardian. So now that we've reviewed some of the terminology related to Medicaid, I want to review the financial criteria related to Medicaid eligibility. Financial criteria falls into two categories. You have income and resources. Understanding the difference between income and resources and the eligibility criteria for both is really essential in maintaining your Medicaid eligibility. So income is the money that the person receives. It can include earned and unearned income. So earned income includes wages from work, and unearned income includes things like your Social Security benefit, child support, or interest on savings accounts, veterans benefits, and pensions. Child support is considered the child's income, not the parent. And the DFR may require proof of income such as pay stubs and award letters to be submitted during the initial eligibility or the annual renewal process. If a person is approved for the waiver, a special waiver rule allows parental or spousal income not to be counted when determining eligibility for the aged, blind, or disabled categories. When the person is on the waiver, only the income of the waiver participant is collected and counted. However, this special waiver rule only applies to Medicaid for the aged, blind, and disabled categories. I will say that if a parent's parental income is requested by the DFR, I would go ahead and submit that documentation that is requested to the Medicaid office, but make sure you note that the minor has an active waiver and that your income should not be counted. There's another special waiver rule related to income limits. For a person who has an age, blind, or disabled aid category, the waiver participant can have monthly gross income up to $2,982 a month. This amount varies from year to year, and it is 3 times the current maximum SSI amount, which in 2026 is $994 a month. Without the waiver, the income limit for Medicaid for the aged and disabled is significantly less, around $1,330 a month. Of that $2,982 a month of income, up to $1,690 a month can come from earned income or work. So the $1,690 is the current standard for what's called the substantial gainful activity, or SGA, amount that is set by Social Security. The SGA is a little higher for Medicaid for the blind. If the total is over $2,982 a month, a qualified income trust, also known as a Miller Trust, is needed. The excess income goes into the trust, and the funds are used to pay for Medicaid services and the amount that the person is over the $2,982 a month. This is called a waiver liability. MedWorks is the Medicaid program for people with disabilities who are working. It follows many of the guidelines for Medicaid for the disabled. A person needs to be employed in order to qualify for MedWorks. A waiver participant is required to be on MedWorks rather than Medicaid for the disabled if the income from work is over $1,690 a month gross. That's substantial gainful activity level set by the Social Security Administration. If they work and income from work and Social Security benefits totals over $2,982 a month, they may elect to be on MedWorks rather than establish a Miller Trust, which would be needed for Medicaid for the disabled. There may be a monthly premium that would need to be paid based on a sliding scale of total income that includes both earned wages as well as unearned, which would include Social Security benefit. The premium for MedWorks does need to be paid before Medicaid benefits will show up as active. A resource is defined as real or personal property that is owned solely or jointly by a Medicaid recipient. So this includes cash on hand, checking, savings accounts, retirement accounts, bonds, stocks, and the cash surrender value of a life insurance policy that's owned by the Medicaid recipient. The majority of Medicaid aid categories do not factor in resources. However, they are collected and counted for Medicaid for aged, blind, and disabled categories. The resource limit for a single person is $2,000. This is the total of all non-exempt resources in the person's name as of the first of the month. The amount of the available funds in checking, savings, 401k, IRA, bonds, stocks, and the cash surrender value of a life insurance policy owned by the Medicaid recipient are all tallied and need to be under $2,000 as of the first day of each month. MedWorks is the aid category for people with disabilities who are employed. For MedWorks, funds in a retirement account are excluded from the $2,000 resource limit. So with MedWorks, money in a 401k or IRA does need to be reported to DFR, but it is not counted towards the $2,000 resource limit. The Division of Family Resources has an asset verification system. All states are required to implement this system under the Social Security Act. When resource information such as bank accounts and vehicles are required for eligibility determination, DFR will verify using the asset verification system. The request is sent to sources such as Equifax and LexisNexis, and the information is returned to the Division of Family Resources for processing. The information from the electronic reporting will show on the Medicaid redetermination mailer. If what is electronically verified is not correct, the individual, guardian, or authorized rep can turn in additional information or documentation to the DFR. Some property owned by the Medicaid member does not count towards the $2,000 resource limit. These are considered exempt resources. The most common exempt resources include the home if the person is living it, personal effects and household goods, and one car. There are ways to save money so that the $2,000 resource limit can be exceeded using exempt options. These include irrevocable funeral trusts, irrevocable special needs trusts, a pooled trust, or an ABLE account. Although they are not counted towards the $2,000 resource limit, vehicle information, trust, or able documents do need to be given to the DFR along with the account balances. Let's take a look at these in a little more detail. So money can be set aside in an irrevocable funeral trust to pay for the funeral-related expenses of the Medicaid member. The funeral trust can be used to cover such expenses as the services provided by the funeral home, staff such as a clergy, the burial at the cemetery, as well as the reception following the funeral. Funds can be deposited all at once or over time. It does need to be an irrevocable, and the funds cannot be used for anything except those funeral and burial related expenses. Any funds remaining in the account after funeral related expenses are paid may be subject to Medicaid recovery or estate recovery. Medicaid estate recovery, also known as Medicaid payback, is when the remaining funds are used to pay Medicaid expenditures upon a person's death. The value of the trust does not count towards the $2,000 resource limit for Medicaid. A funeral director can provide more information about establishing an irrevocable funeral trust. A special needs trust is an irrevocable investment that holds funds for the benefit of an individual with a disability. Funds in the trust do not count toward the $2,000 resource limit for Medicaid or SSI. The trust is set up to ensure the care of the individual with a disability. It is often used for inheritances. Funds can be used to provide items and services to improve their quality of life that are not covered by benefits. A trustee determines if the request to remove funds is appropriate under the terms laid out in the trust. The individual with the disability does not have direct access to the funds. A special needs trust can be established with the support of an attorney who is familiar with the Medicaid and SSI requirements for exempt resources. There are two ways that a special needs trust can be funded. A first party or self-funded trust hold assets that belong to the individual with a disability. These trusts may be subject to Medicaid estate recovery. Third-party trusts hold assets that came directly to the trust from someone other than the individual with a disability, such as a parent. These trusts are likely to require reimbursement to the state for its Medicaid costs upon the death of the individual. A variation of the special needs trust is a pooled trust. A pooled trust pools the resources of many beneficiaries, and the resources are managed by a nonprofit agency. Each individual with a disability has their own account. It can be set up as either first party or third party. If first party, the funds can remain with the nonprofit agency rather than going to pay for Medicaid related expenses upon the individual's death. The rules and procedures around Medicaid estate recovery are complicated. The state has a lot of really good information about it on their website. ABLE stands for Achieving a Better Life Experience. It is a 529 plan, and many of us know about the 529 college savings plans. With the ABLE account, you're saving for disability-related expenses. In order to qualify, the disability needs to have occurred before the age of 26 and be as severe as defined by Social Security. Anyone can contribute to a person's ABLE account. Total contributions can be up to $20,000 per calendar year. Funds in the account are not taken into consideration when determining eligibility for Medicaid or supplemental security income. The account balance must remain under $100,000 in order to be eligible for SSI. Funds in this account can be used to purchase qualified disability-related expenses, which is any expense related to the individual's disability that assists them in increasing or maintaining their health, independence, or quality of life. An ABLE account may provide more choice and control than a special needs trust. The account owner has the ability to control their funds and make withdrawals as needed through safeguards, although safeguards can be put in place. It can be set up so that funds can be withdrawn by the individual using a debit card. There is one limit, ABLE count per person. Indiana's ABLE program is called Investable Indiana, and the website, is shown here on this slide. However, many states offer ABLE programs, and Indiana welcomes residents to participate. The fundamental feature of the ABLE account is defined by the federal government, but investment options may vary from state to state. The Division of Family Resources does not count the funds in the ABLE account towards the $2,000 resource limit, including those established in other states. The ABLE National Resource Center is a very valuable resource. They offer webinars about ABLE accounts, which are later posted on their website. They also have the details of each state's ABLE program to allow for comparison. Medicaid for the disabled is the primary aid category that works with the family support, health and wellness, TBI, and community and rehabilitation integration waivers for people ages 19 through 64. We just talked about the financial eligibility criteria. Since Medicaid for the disabled is so important to adult waiver participants, I'd like to spend some time going over the disability criteria and the relationship with Social Security disability. There's a strong link between Medicaid for the disabled and Social Security disability. Social Security disability is an umbrella term that includes SSI and SSDI. Medicaid for the disabled uses the same criteria for determining a person disabled as Social Security does. For minors under the age of 18 to be considered disabled, the person must have a physical or mental condition that results in marked and severe functional limitations. For adults to be considered disabled, the person must have a physical or mental condition that keeps them from working at a substantial level. This determination of disability for Medicaid and Social Security disability is different and separate from the criteria for the Medicaid waiver. If a person receives Social Security disability benefits, which includes supplemental security income or Social Security disability insurance, then they meet the disability criteria for Medicaid for the disabled. If Social Security has not made a determination, then the Division of Family Resources uses their Medicaid Medical Review Team, also known as MRT, to determine if the person's disability meets the Social Security criterion for disabled until Social Security makes a determination. SSI stands for Supplemental Security Income. It is a payment for low-income individuals who are aged or disabled. The full amount of SSI benefits for 2026 is $994 a month. A person may not get the full benefit amount if they are working or do not have any living expenses. Like Medicaid, SSI has a resource limit of $2,000. Household income is counted when determining financial eligibility for SSI until the applicant is 18. If a person receives SSI, they will be automatically eligible for Medicaid. The aid category will be MASI to reflect that they are receiving SSI benefits. SSI recipients do not need to complete annual recertification for Medicaid. They are automatically eligible for Medicaid, even if they've never applied for Medicaid. SSDI stands for Social Security Disability Insurance. It draws from a person's work history. If a person is determined to have a disability prior to the age of 22, then they can draw off the parent's work history if the parent is deceased, disabled, or retired. The amount of SSDI is based on the person's work history. If a person's SSDI is below a certain level, they can be eligible for both SSDI and SSI. SSDI does not automatically make a person eligible for Medicaid. It does show the DFR that the person has a disability. However, since the SSDI amount is often more than SSI, they need to verify that they meet the income and resource guidelines for Medicaid for the aged or disabled. As we discussed before, the income limit for Medicaid for the disabled for a waiver participant is $2,982 a month total income, with up to $1,690 a month of that coming from work. Although Social Security does not consider resources for SSDI, non-exempt resources do need to remain under $2,000 for Medicaid eligibility. Unlike SSI recipients, SSDI recipients need to complete annual recertification for continued Medicaid benefits. There was a cost of living adjustment for Social Security recipients for 2026. If you are an SSDI recipient, you will want to keep your SSA award letter with the 2026 monthly amount. There is a good chance the Division of Family Resources will request a copy if they're not able to verify the increase through the electronic exchange with Social Security. If the Division of Family Resources requests a copy of the Social Security award letter and it is not provided timely, it can result in Medicaid being terminated. If a person is determined not to be disabled by Social Security, it can have a direct impact, unfortunately, on their ability to be eligible for Medicaid for the disabled, causing them to potentially lose waiver services. Although it does apply to both SSI and SSDI, I'm going to focus on SSI today as it is the most prominent benefit being applied for by waiver participants. If Social Security determines that a person is not disabled, then DFR is required to also determine that the person is not disabled and therefore not eligible for Medicaid for the disabled, even if they are already receiving Medicaid for the disabled coverage. I just want to repeat that if a person applies for SSI and is determined not to be disabled, it is vital that they appeal the SSI denial through Social Security and that DFR is given a copy of that appeal. If you receive a notice from FSSA that Medicaid is ending due to a negative decision regarding disability by Social Security, you'll want to take a copy of the SSI appeal to the local Division of Family Resources and ask to talk with an eligibility manager to make sure that it is processed correctly to keep the Medicaid for the disabled active during the appeal. Although you could submit the appeal some other way to DFR, it is very helpful to take this added step of actually going into the DFR office and talking with a state eligibility manager to ensure that Medicaid remains active during the appeal, as you have a lot riding on keeping the Medicaid active. You also want to consider appealing through FSSA to make sure that DFR is following the rules around the impact of a Social Security disability denial on Medicaid benefits. When following up with a Social Security appeal, you will want to make sure that all available records were submitted, and you can still obtain records and submit to the SSA for reconsideration. You may also want to consider consulting a disability attorney. The disability attorney will review the case and determine if they will accept the referral, as they are working only for a portion of the SSI back payment if they win. Next, I want to talk about the steps needed to maintain Medicaid eligibility. Medicaid eligibility is redetermined at least annually for almost everyone except those SSI recipients. There is a recertification process that needs to be completed. In some cases, DFR has enough information to automatically renew eligibility, but is not the norm. I will go into more detail about how to reestablish Medicaid following a loss, as well as share some tips about how to retain Medicaid so that Medicaid does not lapse in the first place. Lastly, I will discuss the new work requirements for those with health coverage under the Medicaid expansion plan. Once Medicaid is established, it is redetermined at least annually. The recertification month typically stays the same from year to year. However, there are factors that could cause it to be completed in a different month. As a team, you want to help to assure that the waiver participant's Medicaid does not lapse. You want to make sure that the waiver participant is meeting the income and resource limits for their Medicaid. You also want to help assure that recertification paperwork is turned in to the DFR by the due date. When a person is on the waiver and has either Medicaid for the aged, blind, or disabled, you only need to report income and resources if in the waiver participant's name. You do not need to report parental income or resources, nor those of other household members. But please keep in mind that not everyone on the waiver has Medicaid for the disabled. Parental income does not need to be reported for those minors on the other types of Medicaid. parental income does need to be reported. The information gathered from the asset verification system will show on the Medicaid redetermination mailer. If what is electronically verified is not correct, the individual, guardian, or authorized rep can turn in additional documentation to DFR, such as bank statements, proof of life insurance policy that has been cashed out, or maybe that the vehicle ownership has changed. You also want to ensure that all requested information is reviewed by the DFR by the due date. Authorized representatives receive a full copy of the Medicaid redetermination mailer so that it is easier to assist in returning any information required to continue eligibility. The recertification form is called the Medicaid redetermination mailer. The household composition as well as financial information will typically be pre-printed on the form. It is usually sent about 6 weeks before the recertification date. There's a cover letter that can be misleading for waiver participants who have Medicaid for aged, blind, or disabled. It says that if there are no changes required to the form, then no action is needed. However, recipients of Medicaid for the aged, blind, and disabled need to report their income and resources. In general, if you receive the Medicaid mailer, I would encourage you to review marketing needed changes, sign, and return it with supporting documentation related to income and resources. This is an example of an income or resource-based annual mailer. The first 2 pages outline the date the mailing was sent and what is being evaluated. You will also find your case number in the right upper corner of this notice. Your case number is important to know if you need to contact the Medicaid office in the future for further information. Your case number is different than your RID or Medicaid ID number, and the case number can change as new cases are opened or closed, but your Medicaid ID number, your RID, will remain the same. The next page of the mailer details the address and household information. You will want to confirm the correct living and mailing addresses are listed. For an adult over 18, you should include in the box below that the individual is a household of 1 if others are listed. This page of the mailing lists all employment information. Again, you'll want to verify that what is listed is correct and to add any changes needed. The next 2 pages of the mailing lists all other income and resource information. Again, you will want to go over what is on this document to make sure it's correct and to make any changes as needed as well. The last page of the annual mailer is the most important page. It is a signature page. This must be signed and returned to the Medicaid office, whether or not changes or additional information is being sent. I have seen individuals who have lost Medicaid benefits, unfortunately, just because this page is not signed and sent back into the Medicaid office. So it's really important to make sure that you get your annual renewal documentation in time to be able to send this page back in. There are times when Medicaid is unfortunately, there are times when Medicaid is automatically renewed without receiving the Medicaid redetermination mailer. If the person receives SSI, then they are automatically eligible for Medicaid as long as they are active receiving SSI benefits. If a person has no income other than Social Security benefits and the waiver participant has no resources in their name, DFR will automatically determine the person eligible for Medicaid at renewal time. However, if you receive the Medicaid redetermination mailer, I would encourage you to complete, sign, and return with any needed supporting document. Sometimes Medicaid will lapse at recertification. Medicaid typically lapses due to one of these reasons. The Medicaid redetermination mailer was not completed and returned to DFR. All documentation was thought to have been turned in, but it was not received, not complete, or turned in late. The person was over the $2,000 resource limit, or a new resource was discovered, such as life insurance policy that was not fully reported, or that put them over the resource limit. Documentation is a vital part of the annual renewal process. DFR only confirms receipt of documents if it is hand-delivered to the office. A fax receipt does not count as proof of submission. Best practice is to always take requested documents into the Medicaid office in person and have them date stamped. FSSA will not guarantee that documents faxed in will be received or processed into an individual's case. DFR does not typically let you know if documentation received was incomplete or unclear. It takes 1 to 2 days for documentation scanned into their system to be visible to the DFR caseworker. You always want to call DFR 1 to 2 days after documentation is submitted to assure that it was received, that it included everything that was needed, and that it will be processed. You will want to ask the caseworker to review the documents submitted to assure that it was everything that was requested, even if you hand-delivered the documents to the local office. The local office will scan the documents into their system, but the front desk staff typically do not review to assure that it was everything that was requested by the caseworker. It is especially important to call DFR if the recertification documentation was submitted late. There's a barcoded cover sheet that comes with the pending verification request, and you'll want to make sure that you use this when submitting documents to the DFR, as it helps to assure that the documents make it into the correct file. You want to make sure that you retain Medicaid eligibility in order to keep your waiver active. In addition to making sure that the Medicaid redetermination mail is returned, you also want to make sure that any changes are reported to the DFR. I've got the 1-800 number for Medicaid listed here, and it is the number for the whole state of Indiana. You will want to make sure to report a change in address so that you receive the Medicaid redetermination mailer and other notices coming to you from the DFR. You also want to report a change in phone number as well. You need to report any changes related to finances, such as income, a new job, a loss of a job, and changes to resources. If Social Security benefits are changed from SSI to SSDI, you definitely need to report that to the DFR, as it will require an aid category change for continued Medicaid eligibility. You also want to make sure that the authorized representative remains current. You want to be on the lookout for any notifications or annual redetermination packets in the mail from FSSA. Know your annual redetermination date and look for information in the mail coming from the FSSA within 60 days of that date. If you do not know what your annual redetermination date is, call or go into the FSSA office and ask for the date. It is important that you watch your finances and make sure you keep your income and resources within the asset limits for your Medicaid aid category eligibility. You will also want to talk with your doctor and make sure that all of your medical documentation is up to date regarding any diagnoses or conditions in case this information is requested by Medicaid. I would like to go into more detail about what to do if Medicaid does lapse. If you are the person responsible for maintaining Medicaid, you need to know why it lapsed. You need to call or go by the DFR and talk with a caseworker to determine why it lapsed. Once you determine why it lapsed, you need to ask the caseworker exactly what's needed to reestablish the Medicaid. The actions needed usually fall into one of two categories. Either specific documentation needs to be submitted or a new Medicaid application needs to be filed. If the caseworker responds that specific documentation is needed, then you'll need to gather that documentation and submit to the DFR. Use the cover sheet to assure that the documentation ends up in the correct file. Then follow up with DFR 1 to 2 days after the documentation was submitted. During the call or visit to DFR, you want to verify that documentation was received and included everything that was required, and that the file will be forwarded to the state for final review. You will want to continue to call the DFR and talk with a caseworker weekly to check status until an eligibility notice is received. When you talk with a caseworker, ask them questions to assure that the file was sent to the state, it is still pending state review, and no further documentation has been requested. If the initial response from the caseworker was that a new Medicaid application is needed, rather than simply submitting missing documentation, you'll need to submit a new Medicaid application. This can be done online at the local DFR office by requesting a paper application or over the phone with the assistance of a DFR caseworker. Once the application is completed, you can expect to hear from DFR to schedule an interview within a week of the application being submitted. The interview can be completed either by phone or in person at the local DFR office. If you don't know the day and time of the interview within a week of the application being submitted, you would want to call DFR to make sure the application was received and to schedule the interview. During the interview, the caseworker will ask questions about the person's income and resources. If the person does not receive Social Security disability, they may also ask questions related to disability. Once the interview is completed, DFR will send a pending verification list of specific documents that need to be submitted. These requested documents need to be received by DFR by the assigned due date, which is typically 13 days after the interview date. If requested documents are not received by the due date, the Medicaid application will be denied. If unable to obtain requested documentation, you need to contact the DFR to explain difficulty and determine if a different type of verification could be obtained. You never want to simply turn in something that has been requested. Or excuse me, you never want to simply not turn in something that has been requested. Once documentation has been submitted, complete the same follow-up procedures previously discussed. If you're aware of the Medicaid loss, but not directly responsible, there are a few things that you can do to provide support for reestablishing Medicaid. The first is to make sure that they are aware of the Medicaid lapse. You would want to encourage the individual to contact DFR to determine why it lapsed and what actions are required to reestablish. You would also want to stay in contact with them to ensure that continued progress is made. You can encourage them to follow up with DFR as needed. You can also make sure that they understand the steps to resolve. You can assist with obtaining needed documentation and explain what to expect once the new application is filed, such as the interview and the documentation timeframes. You can also offer to become an authorized rep to be able to talk directly with DFR about the case and obtain copies of the notices. You may run into some stumbling points in the process, as I know many have. You may contact DFR and the caseworker won't be authorized to talk with you. In that case, you may need to submit an authorized rep form or a copy of guardianship papers. A new authorized rep form needs to be submitted anytime a new Medicaid application is submitted. In the meantime, you could complete a three-way call with the person or accompany them to the local DFR office. I often hear that people have a hard time reaching DFR. They are open Monday through Friday, 8 a.m. to 4:30 p.m. Monday through Friday, and if you can't reach them outside of those time frames. There's one phone number for the whole state, and it can be a bit of a maze navigating the touch tone options. Your best bet when calling is to enter 1 when first prompted, then a 7 when next prompted. It will then ask for your zip code. You will enter that. It will then ask you to enter 1 if the zip code is correct. It will then be answered by a live person. If all else fails, visit the local DFR office during their hours of operation. I am often told by people that they have done everything needed and are just waiting to hear back. You do not want to assume that the application or submitted documentation is being processed. Typically, no news is not good news. You will want to call DFR every 7 to 10 days until the Medicaid issue is resolved. One of the more tricky stumbling points is when DFR tells a person that their Medicaid is active when it really isn't. When this happens, the DFR caseworker may not be looking at the traditional Medicaid. There is a type of Medicaid called Qualified Medicare Beneficiary, or QMB. QMB pays the Medicaid Part B premiums, but is not comprehensive health insurance. If you are told that Medicaid is active, then you need to ask specifically about full Medicaid, or specifically by the aid category, such as Medicaid for the disabled. The last stumbling point that I want to review is exceeding the $2,000 resource limit. DFR looks at the total of non-exempt resources as of the first day of the month. If bank statements and other documentation submitted shows that the balance is over $2,000, a new Medicaid application is typically required. You need to ensure that the total of all accounts is under $2,000 by the first of the next month and then reapply. If large amounts of money are moved or purchases made, you'll want to be prepared to show DFR receipts of the transactions. You will want to ask specific questions of the FSS's caseworker when you either go into the local DFR office or call in. On this slide, I've got some handy tips and questions that you can use to ask when you're talking to an FSS caseworker. Please know that cases are worked by FSSA caseworkers in the order they are received, which means that a caseworker may not be able to give you an exact time frame as to when documents will be worked into your case or when a final determination regarding your approval for benefits will be made. It is important to check in with the FSSA office on a weekly basis to make sure that nothing further has been requested of you during the approval process. The federal government has mandated new regulations that begin in 2027 for states that affects individuals receiving Medicaid benefits under the expansion plan, such as the Healthy Indiana Plan, also known as HIP, that requires individuals aged 19 through 64 to complete at least 80 hours of work each month. Those individuals receiving Medicaid benefits through HIP that are aged 19 through 64 who are not pregnant or enrolled in Medicare must complete this requirement in order to maintain their Medicaid benefits. Individuals with an active waiver are not under the A category HIP, but rather under traditional Medicaid and therefore are not affected by this new work requirement. So to reiterate, if you have a waiver, you do not have to meet these work requirements. The new work requirement for HIP recipients starts on January 1st, next year, 2027. You will be evaluated annually, starting with your first biannual redetermination in 2027 and every 6 months afterward during your Medicaid renewal. So for example, if your annual Medicaid redetermination date is January 1st, then your work requirement must be fulfilled for October, November, and December of 2026 in time for your redetermination January 1st of 2027. Redeterminations to verify that you're meeting the work requirement and basic Medicaid eligibility will be conducted every 6 months after. A FSS caseworker will use an electronic verification system as well as information already on file to check that you've met the work requirement every 3 months. You can complete a variety of different activities in order to meet the work requirement. This includes working a job, college or job training, an internship, a work program, or going to school at least half-time. You may use a combination of these different activities to reach the 80-hour requirement. If you do not meet the 80-hour a month work requirement at the 3-month check, then you will lose your health coverage under HIP. A FSS caseworker will evaluate your case to see if you meet eligibility for Medicaid under a different aid category. If you do not meet eligibility for coverage under a different aid category, you may choose to either reapply for Medicaid if you believe you're eligible for it or sign up for a health benefit through the federal marketplace. That would be self-pay. You do need to report changes, including those to income, address, work, or household size within 10 days to the FSSA. You can report these changes either by logging into your FSSA benefits portal at fssabbenefits.in.gov or by mail at the address listed, by phone through the number listed, or in person at your local DFR office during regular business hours. Again, if you have an active Medicaid waiver and are receiving Medicaid health benefits under any category other than HIP, you do not need to take any action as a work requirement does not affect you. If you are under HIP, you will want to check with the FSSA office to make sure all information they have for you on file is correct. Check to see if you are exempt from the work requirement, and most importantly, if you are required to meet the work expectation, that you have a plan or make a plan as to how you will meet it. If you do not already have an FSSA benefits portal account, you will want to set one up as soon as possible. I would like to finish by reviewing some resources that are available to you related to Medicaid. The DFR portal is located, as I said, at the fssabbenefits.in.gov. Although there are other websites with links to it, this is the most direct link. This is where you would go to apply for Medicaid. You can also create an account as the authorized rep and check status of the case. You can print the barcoded cover sheet, check the interview date, look at non-specific lists of pending verification, and a non-specific list of documents received on the case, as well as report changes. This is the link to the Indiana Medicaid main website. It is a resource for Medicaid providers as well as Medicaid recipients. It has some of the best family-friendly descriptions about Medicaid eligibility, programs, and benefits. There is a resource center that provides clarification of commonly used terms, news about changes to the programs, access to commonly used forms for Medicaid, and contact information for the various Medicaid related agencies. There's also links to apply for Medicaid and to search for a provider. It also gives you access to the Medicaid Health Insurance Manual. That is the manual for what Medicaid as a health insurance covers, such as home health aid, equipment, and supplies. To get the manuals, you need to enter as a provider. And lastly, I want to share some handy phone numbers. There are agencies that are related to Medicaid, whether it is to determine eligibility or for the use of Medicaid as a health insurance. We focus mainly today on DFR, which determines eligibility for Medicaid. DFR has the same phone number for the whole state. The next number is Member Services. You would want to contact them to ask specific questions about what Medicaid covers. Optum RX manages the pharmacy service for traditional Medicaid. You could contact them to ask questions about questions related to pharmacy, such as why a particular drug is not covered. Gainwell Technology oversees the prior approval process for traditional Medicaid. Some Medicaid-funded services, such as durable medical equipment or home health services, need to be approved prior to the services being rendered. Gainwell Technology reviews those requests. Lastly, MedWorks is for people who are disabled and working. There may be a premium payment associated with continued eligibility. You can contact the MedWorks number to pay your premium or to check the status of a premium payment. Thank you for joining me today, and I do apologize I ran a little bit over, but thanks for being patient with our technology issues.
Thank you so much, Beth. I appreciate your presentation. That was super informative. I look forward to seeing all of those resources on our website. Again, give us just a couple business days and we'll have a recording on our YouTube channel as well as on our website. And thank you to everyone who posted a question in the Q&A box. We will get all of those answered and provide that information on a document on our website under the webinar tab. Next webinar is scheduled for November 13th. The focus will be on navigating burnout and stress. We hope to see all of you there. Again, Beth, thank you so much. Thank you to everyone who joined us today, and I hope you all have a wonderful day and weekend. Take care.